I have pinched nerves in my neck, specifically my ulnar nerve, from reduced openings at 3 levels in my cervical spine, so C5, 6, 7. And then I have subluxation of my T1 vertebrae. Well, this is from an old baseball injury from when I was 15, and it came roaring back when I was 50, and I had to make the choice of neck surgery, which I didn't want, sticking things in my neck that would reduce my rotational capacity didn't fit what I wanted to do, so I avoided surgery with a really good physical therapist 3 times a week for 6 weeks, a chiropractor, and a medical massage therapist who actually used to be, or was at that time, my patient. She, at age 50, decided to become a medical massage therapist, and if you have not had a medical massage, it's a whole different animal. I would leave her office like a noodle and have to hydrate really heavily. And my chiropractor now, since this has flared again here in about the last 3 months, taught me something, and I'm going to show you what I'm doing. So I use a little stone, it's a jade stone called a Gua Sha, I think is how you say it. And this has been around in traditional Chinese medicine for about 2,000 years. And the idea is to move the interstitial fluid from inflammation, which I have, in my forearm and my palm, and I have one finger that sticks. So if you can see it, I make a fist, that 4th finger sticks. And so I have weakness of my brachioradialis muscle, which runs along here. Gotta stand up, so it runs along here. And I have a little bit of contracture in my palm. So my chiropractor, Dr. Thompson, is not cracking my neck and adjusting me over and over again. He's teaching me some things that I, as an allopathic trained physician, I didn't really know about. And one of them is using a Gua Sha stone. And this is going to move interstitial fluid, improve my lymphatic drainage, and break up scar tissue and inflammatory debris in the fascia. And you have fascia through your whole body. So let me show you how I do it. So I start with a little biofreeze. So I'm going to put a little biofreeze in my palm, just about that much. I just got to stand up and show you. And I'm just going to move that around. This stuff's really fun. And I'm going to put some of it over here as well, which I'm dropping all over my desk, my table. And I'm just going to do this. And so my pain is right here, right at the bones in my hand. And you can feel this grit when you do this. And it hurts. It kind of goes along with that John Mellencamp song, Hurts So Good. So you do this for about 5 minutes. I'm not going to do it for 5 minutes on this video. And then I turn it around, so I've got this that fits my arm better, and I'm going to do this. So now I'm going to have to clean up the mess I made with my biofreeze. But this can also be used for facial rejuvenation. So I am a cosmetically trained American Cosmetic Cellular Association injector with platelet-rich plasma and microneedling of the face to basically do the same thing, only this thing cost me about $10. Found it on Amazon. There's a whole bunch of different kinds. But if you want to know how to use it, there's a user or a influencer, whatever you want to call, esthetician on the IG platform named Britta, B-R-I-T-T-A, Beauty. Britta Beauty. And she teaches you how to use this. It's an old ancient method of reducing inflammation, improving collagen synthesis, getting rid of fine lines and wrinkles in your face, rejuvenating your skin. And so when I have this done by the chiropractor, he's meaner to me than I am to myself. and I wind up with petechiae, little hemorrhages under my skin, so it's really red. And he said if you were in China, they would do this so hard that you would be bruised for about a week. So he doesn't do it that hard. But even though it's uncomfortable, it feels wonderful once he stops doing it. So I'm going to try this for a while as well to avoid somebody poking plates into my neck and doing other horrifying surgical things to me. So I'm going to finish this little session, and I'll talk to you soon. See you later. Bye.